So I think it's an overall approach of looking after patients, I think, where as oral health practitioners, we don't just focus on teeth and the mouth, but we have to focus on the person, their general health, their mental health, and their overall well-being. And it's something that perhaps in dentistry is not really focused upon enough. And I think in the modern world and the way everything is changing, I think it's really important that this is a facet that's brought into looking after patients when we're focusing on the mouth. That's a really good question, and it's actually quite difficult to measure when we talk about oral health. People talk about quality of life in medicine and looking at the medical aspects and quality adjusted life years, QALYs, and other measurement indices. For oral health, it's not quite that simple. And I think a lot of it is the psychological aspect, that actually people value their smile, and teeth clearly are a big part of that. Of course, function as well and all those other things. But I think it's the feel-good factor. If your mouth is healthy, teeth are healthy, then actually that has quite a big impact on how you psychologically sort of feel about yourself and how you project to others with confidence and things like that. I think these sorts of bioactive materials clearly will have that biological impact, which you can look at sort of short to mid-term. But then if you look at the impact, as we've said, on general health, on mental health and psychological health, I think that clearly is a more long-term effect and benefit. So when we look at oral health and quality of life, the way to deliver that is something called minimum intervention oral care. It's a framework, a delivery framework, a care delivery framework. Part of that involves minimally invasive operative dentistry. So when patients come in with disease and lesions in their mouth, we have to repair them and fix them. So I think this is where Biodentine comes in, because Biodentine is a really clever bioactive material. And as we've been hearing about and we know about, it helps to heal tooth structure and pulp tissues, which is really quite innovative. So it's not just a material that just fills a gap, but it's actually allowing the biology to work in the tooth. And by doing that, it means we can retain teeth for longer. And I think by doing that, we can then impact quality of life for people in general. So it's the maintenance of the tooth structure and the maintenance of the tooth in the mouth where I think Biodentine has a really big part to play. The modern contemporary approach of delivering oral health care, and I don't even call it dentistry now, it's actually oral health care, is using this minimum intervention oral care framework. And what that is, it's a team-delivered, person-focused, prevention-based, and risk or susceptibility-related framework. And that consists of 4 interlinked domains where the team, the oral healthcare team, so that's dental nurses, dental hygienists, dental therapists, dentists, practice manager, reception staff, clinical dental technicians, everybody is singing from the same hymn sheet. And we help the patient to assess them in terms of detection and diagnosis of the problem. So that's one domain. That then links into prevention of lesions and control of disease. So this is really where we push behavior change. So it's all that behavioral modeling and goal setting and working with the patient to do this. And this could be done in the clinic, it could be done sort of online through sort of video calls and things like this. Clearly, patients will present with lesions in their mouth, with holes in their teeth, or bleeding gums, or whatever it might be, or in pain. Therefore, they need to be treated. So the third clinical domain of minimum intervention oral care is minimally invasive dentistry. And this is, again, where Biodentine and all the materials and technologies come in. So we have to do the sort of operative work. And then the fourth domain is the recall We often do, well, certainly in the UK, we often use a term called checkups, you know. I really dislike that terminology because it totally devalues a really important part of care. Because that's where, again, the whole oral healthcare team can help that patient, facilitate that patient in terms of behavior change, in terms of susceptibility assessment, and active surveillance of the work that has been carried out. So if fillings, restorations have been put in teeth, they need to be checked. But again, a dental hygienist, dental therapist can contribute to that clinical domain as well. In the first domain of that detection diagnosis, a dental therapist and the dentist are probably the two key team members. Dental hygienists can contribute to that. The prevention and control domain, most definitely dental hygienists, dental therapists, extended duties dental nurses, and of course dentists as well. They're not excluded, but you can see how these roles can be adapted. In terms of minimally invasive operative dentistry, the third domain, then usually it will be the dentist and or a dental therapist if they exist in whichever country we're talking about. 100% care must be personalised. This idea that there are generic protocols and SOPs that people sort of switch their brain off and just follow a list, that's gone. And that shouldn't be happening because that's when problems arise, because each person is different. A procedure might be, fixed. You've got step 1, step 2, step 3, absolutely, no problem. But actually you have to tailor that to the person sitting in front of you, and or the family, the caregiver, whoever else it might be. And another critical part of this is something called shared decision making. So when I was training as a dentist many years ago, you basically told patients, this is what you need, this is what's wrong. We sort of lectured to them, which is terrible. That's not the right thing to do. You've got to work with people now, and you've got to encourage, facilitate, because the patient has to value their oral health. Because if they're not valuing their own oral health, there's nothing we can do as part of the oral healthcare team. It's got to be the patient fixing their own problems. And that's, again, in some cultures, in some societies, I think that's been lost. Patients often go to the dentist because they're in pain and they want the dentist to fix it. And it becomes the dentist's responsibility or their team's responsibility. And when it's not fixed, they get upset. But actually, a lot of the time, 9 times out of 10, the patient's responsible. And don't misunderstand me, I'm not blaming the patient, but this is the interaction. It's got to be a two-way interaction, because we're not talking about just doing treatment for one episode for half an hour or 1 hour. We're talking about lifelong oral health. And we all shower, we all bathe, we all look after ourselves in terms of hygiene. Oral hygiene is no different. And it's often something we say, we'll go and get clothes, we'll get our hair sorted out, all these sorts of things. But then when it comes to oral health, oh, well, somebody else can do that for me. No, it's got to be the patient. So it has to be personalized. To enable patients and facilitate them, I think it is about behavioral modeling, and one of those aspects of that is goal setting. So again, when I was trained many years ago, we sort of lectured to patients. We told patients, you need to do this, that, and the other. Now I think it's important that the patient is taken along that journey. So if a patient, for example, has a high sugar diet, let's say, okay, and we're trying to help them change that diet. There are ways and means by which we work, looking at the capability, the opportunity, the motivation of the patient, to see whether they intrinsically will be able to change their behavior pattern. And then our job as the oral healthcare team is to help them. And so actually we always talk in dentistry about all the operative techniques, the materials, using your hands and doing procedures. The most complex bit is actually the behavioral bit. It's tapping into the patient and finding those right psychological switches. Because if you can do that, then you can maintain lifelong oral health, and it works. There's no debate, it works. The challenge is, for all these people, is finding the right switches, the right buttons to press. Not always easy. not always easy, but the oral healthcare team, that's central to successful care and long-term management. Dental school, we're starting to teach this behavioral psychology, which is actually, when I was a student, it was probably one lecture and that was it. Now it actually forms a really key part of the curriculum, and also at postgraduate level. And you sort of learn on the job. It's not something you can necessarily just pick up a book, read it, and then do it. You have to work with people. You have to communicate. And those are the what we used to call soft skills, but they're not soft skills. They're very, very, very hard skills, literally and metaphorically. But if you can do it and you practice, and the team does it together, you can role play. You can, when you're in a practice environment and you have your team there, you could, you sit down and on study days and things, and you can get people to actually discuss how you do it. There isn't a formula in that sense. Each patient will be different. Each clinical team will be a bit different. And it's how that interaction happens. That's the exciting bit of dentistry, I feel. Obviously, we've got materials and technologies and things like that, absolutely. But, affecting people to change behavior is the hardest thing to do. It's the hardest thing to do, but if you can, it's also the most gratifying as a clinician.